Dr. Martinez, let's talk on the line of, if a person gets, for instance, implants, maybe several implants, and or a larger crown, bridge, maybe 3, 4 units, 5 units, whatever it might be, or a couple, 2, 3 units, all over the place. Or even if needed, a denture. And I want to specifically talk about what I keep hearing about the bone loss if a tooth is missing. And yet, when an implant gets put in, that metal screw which gets put in, the body thinks, there's a tooth and there is no bone loss. And I want you to talk a little bit about what that on a long run does to a body in terms of maybe looking older, in terms of, whatever else it might do.
Well, actually, the reason that when we extract a tooth or we pull a tooth and the people start getting that sunken in look or that older look, especially when talking about people that require dentures and have had teeth extracted for a very long time, what happens is bone needs the stimulation of the roots for continued growth. When you don't have roots in there, you have nothing stimulating that growth, and that's why you get that resorption and you get that, that little old man look without dentures, that sunken in look. Or for ladies, it's not a very good, attractive way of looking. So that is actually probably one of the biggest advantages of having implants in the mouth, that you continue to have that bone stimulation, and so that you don't get the sunken in look at that deterioration of bone, and especially if it's done, for instance, if it's done right away after extractions are done and implants are placed, you're actually not missing any of that time or you're not giving it any time for any bone resorption. So that is actually probably one of the biggest advantages of doing implants overall over any other treatment.
And that seems to looks to me like a pretty big one, because after all, none of us likes to look older than we are. I mean, it's all right if we get 50 and 60 and 40 and we look our age, but at least we don't like to look another 10 years older,
Right. Actually, we're trying to do things to always look younger. So to me, that's a no-brainer. If we're always doing, especially with women, putting creams on and doing this and doing that to look younger, why not do a simple thing that is just your God-given right to have teeth in your mouth and either replace them with something that's going to maintain that look for you, that young appearance, or if it's gone, we can actually do, a nice bulked up denture to make it look like you don't have anything missing, like your face is not sinking in. So there are a lot of things we can do, even if people have already lost that bone, to make it look like the appearance that you haven't. But I find also that people that have been wearing dentures for a long time, and they need the dentures replaced. They come in and they take them out, and of course it's a sunken in look. And then what happens is you tell them, okay, you need a new denture. We're going to get you a new denture. The teeth, of course, that you'll have for over 10 years are worn down. You don't have that vertical dimension that is nice. When you smile, you can't even see teeth. And so when you bring them in and you do this new denture, it takes some time for them to get used to it, because as much as we say we like change, people also like the old way of looking, because now people think, so-and-so is going to notice right away that I don't have teeth, or that these are new teeth. But my question is, all the time, is if you're trying to change, it's kind of like when you go get new shoes, you're not going to go get the same pair of shoes. You're going to get a different pair of shoes that is going to make you look different, or a different outfit, or a different coat. Not the same coat, just newer. So again, there's a lot of things we can do, and I think a lot of times people have to trust us in that sense that our eyes are trained to look and see what looks better for patients, what looks good. And again, the one way I look at it is that denture or that bridge has my name on it. When you walk out that door, I want people to ask you, who did that for you? Oh, because it looks really good. And so know and trust that I would never put something in your mouth that I would never put in my mouth. And I think that's very, very important to say. I always ask people when they're wearing these metal bridges or something, or a gold crown in front of on the front tooth, I always ask, does the dentist that put it in your mouth have one like that? Well, no. I said, exactly. Why would they do that to you? That's my opinion, and I think it's a valid one. So
right,
I would never do anything that I wouldn't do on a patient.
Yeah. Well, it's quite amazing to find out, talking to you, of how far away, how far-fetched actually the effects of dentistry go. We talked about it in another video about, perhaps preventing or getting rid of headaches and muscle tensions. We talk about getting rid of a caved-in face, so it's like you're a regular plastic surgeon for that much. I mean, people go and try to do Botox and all kinds of things and fillers to look, nice when, taking care of your teeth is already half of the battle won. Doesn't mean you never get a wrinkle because of it, but, there's a difference between a fallen in, shrunken in, dried out tomato look and, a nice full face because your dentures are there. Absolutely wonderful, quite amazing, what your dentists do. It's really, I don't think most of us people realize, as you said, how far-fetched, how big of an impact, besides of just not having a toothache and having 5 teeth in front which look okay to be, looking good, how much further it goes to have your mouth properly arranged. Thanks a lot, Dr.
Exactly. Thank you.